Most people think that high blood pressure is something you'd feel, like dizziness or chest pain or maybe a pounding headache. But the truth? You can feel perfectly fine and still be walking around with numbers that are quietly putting you at risk for things like stroke, kidney failure, or even worse. And that's how it starts for so many people. There's no symptoms, no sense of urgency, and no real education on why these numbers even matter. That's how high blood pressure has earned its nickname as the silent killer. It doesn't begin with some urgent crisis or obvious symptoms. It starts in the background, like a river carving deep canyons through solid rock. This process doesn't happen overnight. It happens over the course of many years. You may not feel the damage while it's happening, but the damage is there and it's real. Did you know that over 90% of high blood pressure cases are labeled as something called essential hypertension? That's basically a fancy medical term for your blood pressure is high and we don't know why. I mean, think about that. 90% of the time, we are diagnosing patients with a chronic condition while also stating that we just don't know the cause. In today's system, most providers are trained to follow standard algorithms to manage various conditions. And the algorithm for blood pressure management is pretty straightforward. You diagnose, you prescribe, you move on. There's rarely space for root cause analysis, but let's be honest. In most cases, we do know what's driving it. We just don't have the time or a billable code that allows us to dig deeper. More often than not, the root cause of high blood pressure comes down to two major players: chronic inflammation and insulin resistance. Now let's take a minute to break this down. Many people think that insulin is used only for regulating blood sugars, but when your body is working the way that it's supposed to, insulin actually plays another important role. Insulin helps your blood vessels to relax, thus lowering blood pressure. It does this by boosting something called nitric oxide, a natural compound that tells your arteries, hey, loosen up, it's okay, relax. And this relaxation allows blood to flow more freely and keeps pressure from building up. Insulin also opens up tiny little blood vessels called microvessels that help bring oxygen and nutrients to your tissues. Think of it as like kind of turning on those extra garden hoses that reach the various parts of your lawn that normally gets missed. But here's the problem. When you become insulin resistant, or when your cells stop listening to insulin, those benefits disappear. Your vessels don't relax the way that they should, and those tiny microvessels stop opening. And instead of flexibility, you get stiffness. Now, stiff blood vessels are kind of like old rubber bands. They don't stretch. And when your arteries can't stretch, your blood pressure rises. These changes often go undetected for many years. And it's not just about insulin. There's also a fragile coating inside your blood vessels called the glycocalyx. Its job is to help protect your vessels. Think of it as like the nonstick coating of a pan. Too much sugar in the blood, especially from refined carbs or fructose, eats away at this layer, kind of like acid rain on metal. And once it's worn down, everything starts to stick and build up. And once it's gone, the vessels are exposed to damage, increased pressure, and inflammation. But here's the good news. There are things that we can do starting today to help correct this problem. One of the first things that we can do is to help heal insulin resistance with food and fasting. Keep a track of your meals. Start, let's say, maybe next 7 days. Keep a diary, and you might be surprised to see how many hidden carbs are making their way in. If you go low carb and eliminate sugars and processed foods, that helps reduce this inflammatory process, and using intermittent fasting helps give your body a break from the constant insulin spikes. Tip number 2 is to monitor your progress. One reading from your doctor's office is just a snapshot, but your health is a story. Home monitorings help you spot real trends, not just look at isolated numbers, and it shows whether your lifestyle changes or your medications are working. It helps your provider make better decisions, and most importantly, it helps put you back in the driver's seat. You're not just guessing, you are tracking, adjusting, and responding with real insight. The third tip is to rebuild that glycocalyx with key nutrients. To rebuild this layer and support blood vessel health naturally, you need to focus on some key nutrients, and those include vitamin D3, usually around 10,000 to 30,000 IUs a day. This helps regulate inflammation and plays a role in vascular health. There's magnesium glycinate, which helps calm blood vessels, supports relaxation, and helps keep calcium from building up in places where it shouldn't, like inside stiffening artery walls. While it's technically lab assembled, it's not synthetic in the drug sense. It's simply magnesium, which is a mineral your body needs, paired with glycine, an amino acid your body also naturally produces, and together they form one of the most absorbable and gut-friendly magnesium options that are available, which is especially important for older adults or anyone with a sensitive digestion system. If you're curious about where the line is between food-based and supplemental approaches, drop a comment below and I would love to unpack that for you in a future video. Another key nutrient is potassium. Potassium helps relax the smooth muscle around your blood vessel and lower blood vessels naturally. You can get potassium from foods like avocados, bananas, and leafy greens like spinach. And also sulfur-rich foods like eggs and grass-fed meats are also important. They help repair and maintain that glycocalyx itself. But here's the catch. Improving one vitamin or mineral on its own isn't always enough. Here's just a few examples of how that delicate balance works. Magnesium helps activate vitamin D, and without it, vitamin D can't do its job. Vitamin D helps your body absorb calcium, but without enough magnesium to activate the vitamin D, calcium can end up accumulating or building up in places that it shouldn't, like, as I mentioned before, in your arteries. Potassium and sodium help balance each other out, so if you're low on one, the other can cause a problem. Because these vitamins and minerals don't work in isolation, they work as a team. When one is missing, it can throw off the balance of the others, creating a domino effect that disrupts the whole system. Therefore, to truly support your body, especially when it comes to blood pressure, you can't just restore one. You have to rebuild the network. Our bodies are sacred and created with a purpose and design for balance, not just physically, but mentally and spiritually too. And when that balance starts to shift, the signs don't always come as alarms or emergencies. Sometimes they come quietly. Maybe it's your body's way of saying that things aren't flowing the way they should. Because just like a house that collects dust, our bodies and minds can become overwhelmed with everything that we carry. Unprocessed emotions, poor nutrition, spiritual burnout, or chronic stress. So when your blood pressure starts to rise, maybe it's not just a number on a screen. Maybe it's a gentle warning light, an invitation to pause, to reset, to do the internal housekeeping, physically, mentally, and spiritually, to return to the rhythm that we were created for. If this information resonated with you, don't stop here, because we are just getting started. Click on the next video to learn how to restore your health from the inside out, naturally, intentionally, and faithfully. I'm Dr. Lee, and this is where we learn to flip the script because your health was never meant to be managed. It was meant to be restored. I'll see you in the next video.